Okay, so we've just marked this patient out for MesoTox or MesoBotox for the chest area. We're doing chest and neck, and this is really to help with the décolleté chest and sort of the wrinkles, pores, texture, and tone, and even some discoloration. So I'm just going to start injecting this, and I just inject it intradermally. Just a razor wheel. She's already had some numbing medicine, and if you think about the way that we deal with texture and tone of the upper forehead and facial regions, Botox really starts to not only just improve forehead rhytids and glabellar rhytids and crow's feet, but it also starts to change the quality of skin and texture and pores. So there's a beginning of a separation that occurs from the other sun damaged zones, which are the lower face and the neck and chest area. And so with repeated injections, I've started to notice that not only can the wrinkles start to improve, pores, texture, tone, and sometimes even dyschromias can be improved as well. So I believe this is a very potent therapy for patients, especially if you consider the fact that when you're looking at the neck and chest region, deeper types of lasers are really not safe due to the fact that there's not enough sebaceous glands, which can lead to scarring. So you want to be very careful. So I oftentimes use this with the brightening pads with a hydroquinone therapy to just try to help with the surface damage, or I'll do a very light micro laser peel with this. But for some of the deep textural components, I really believe there's nothing like what botulinum toxin can offer in terms of the results. Especially if you look at the damage of the skin, this really provides a deep collagen remodeling. I think that we really don't understand how botulinum toxin really creates an incredible rejuvenation to the skin, but it really does. It is a fundamental cellular change. I'm actually using botulinum toxin for chronic and acute pain across the whole body, chest, back, neck. And how does it work? I've actually seen results with chronic or acute pain within seconds of treatment. It just defies logic. But when I'm treating the neck and chest area, and when I do that, I've noticed not only an improvement overall with the quality of skin, but there's something magical with facial MesoBotox over time. It starts to change the facial shape. I just saw, in fact, my last patient before I came in here, I'd done about 5 or 6 sessions. I'm seeing the face start to have this really nice shape, and I don't know exactly how that's possible. I was on a virtual meeting for a colleague of mine in March of this year in 2020, and talked with a colleague of mine from Singapore who does a lot of these, and I mentioned that I started to notice that the facial shape actually just looks so much more rejuvenated, and I'm not too certain why that is, but it has just a nice shape. Now, the one warning is I've noticed when I do facial injections is that there's some diffusion through the skin that can affect the zygomaticus muscle and cause a little bit, not of a paralysis in the sense of like a stroke or anything, but the face is just not able to have a full expression for the first 6 weeks in most patients, and I warn them of that. And occasionally that can actually endure, in rare cases, for about 3 months. Never permanent, but that's just something that people need to be aware of when you're doing it in the face. But if you think about the power of botulinum toxin in combination with face, neck, chest areas, there is just something incredibly rejuvenating with it that simply cannot be had with conventional lasers, etc. In terms of other modalities that I feel would be very effective with this treatment is also microneedling. Now, I don't believe that conventional microneedling is very effective as a standalone modality or even as a therapy, but radiofrequency microneedling can be quite effective, and I tell my patients that with that therapy can actually further enhance results. I believe that the radiofrequency component is really the key. The microneedle is only the point of delivery. It's not really delivering the final goods. The radiofrequency is. But in combination with this MesoBotox, I think can be quite effective. When patients ask me which is more effective, I say this is more effective than radiofrequency microneedle. But it's sort of like Reese's peanut butter cups. You combine two of them together, you get a better result than any standalone. So of course, this is like watching paint dry. I've not showed you anything else that's novel, but I think it's helpful to see the whole process unedited from start to finish. And I just come back here and I just add areas that I still have extra that I drew up, and I really want to get this nice lady an amazing result. So anywhere that I see that there are some blebs that I haven't quite nailed, I just go ahead and add additional treatment. So I really try to make this whole area excellent for her, and you can almost not put too much of this in there, sorry. It's a little more discomfort near the clavicle and near the midline, even with some of the numbing cream. But that's it, I just continue. So hopefully this little video is a good adjunct to my chapter on this subject.